Good evening, po. So that's a wonderful question, po. I support that decision by the president and his cabinet for the following reasons. At this time, the Filipino people have to learn to live with the virus, which means that we have to take responsibility. Each of us has to take responsibility for our COVID health. And what's going to happen now is not that no one will wear masks, but each one has to learn how to do the risk assessment, the individual risk assessment to determine whether or not you can wear a mask, you should wear a mask. So for example, younger people who have been vaccinated and boosted and who already got COVID once or twice, they may decide that the risk for another COVID is very low, so they will not wear masks. But for those of us who are senior citizens, who are immunocompromised, who may not be vaccinated for one reason or the other, we have to decide and we have to choose to wear the mask for our own protection. And there's data that shows that a very good face mask will prevent COVID, prevent you from getting COVID if you've been vaccinated. So I think it's the proper step. The XBB variant that is now in the Philippines is the mildest form of COVID so far. It's even milder than B4 and B5 according to the data from Singapore. So at this point, our country is ready to learn to live with the virus. And the calculations show that in the last 3 months, only about 0.3% of cases need the ICU, which means that our ICU beds are secure because the disease is so mild. We would have to experience an incredibly huge surge to threaten the hospital care system, and this is not going to happen with one of these mild Omicron variants.
How about, Father, yung sa XBC? Kasi di ba sinasabi nila, baka immune evasive din ito, tapos nakapagtala pa tayo ng 5 casualties because of this variant. So, hindi po ba ito cause of concern?
So thank you. That's a good question. From what I understand, and it's hard to know exactly because the DOH has not really released all the data, but from what I've heard, the XBC variants, the fatalities associated with that were unfortunately unvaccinated Filipinos. And these were some in areas of our country where the vaccination rate is low. So again, this is why it's so important to stress that we should get vaccinated and boosted when the time comes for our boosting. But given that a significant number of Filipinos are already vaccinated and a growing number are boosted, we need to enhance that number. But still, so many of us have been vaccinated and so many of us have already been sickened with COVID that the hybrid immunity, the immunity from the vaccines and the immunity from the natural infection is quite strong, and that will protect us from XBB and more likely XBC, even though we don't have much experience for that. And you can see that the hybrid immunity is very strong in the country because the B5 recent wave was very low. It was only, it went up to several thousand per day, and then it started going down. And the most recent little blip in the NCR, which I believe in after conversations with my colleagues in OCTA, is probably explained by the XBB. Again, the surge was so small, suggesting that the population immunity of the Philippines is quite good right now. And we thank God from that. And that's because of the many previous surges we have had, on top of the vaccinations, on top of the boosters, which need to be increased. But putting it all together, it looks like we are in a good place.
Nako, Father, isisingit ko lang ito kasi we're talking about bakunahan, no? Kahapon lang, may kausap po ako, Father, na nagsasabing dun daw sa mga kumare niya kasi pinabakunahan yung mga bata. 'Di ba? Sinasabi po nila, naku, after binakunahan yung anak ko ay nagka-asthma na kasi when the kid was born, walang asthma. Tapos ngayon parang 8 years old na ata, 8 or 9 years old. Sabi nila, ako baka dahil sa bakuna yon biglang nagka-asthma na. So, ano ba, Father? Anong
Thank you for that question. There is no data from the billions of people who got vaccinated that there is a direct link between vaccination of kids and asthma. So it just might be a correlation. That means that they got vaccinated and they got asthma, and they would have gotten asthma even if they did not get vaccinated. We do not know the cause and effect, but the data from around the world suggests that there is no link, that vaccinations do not trigger childhood asthma.
Oo, kasi ang sinasabi nila, Father, ay dati, hindi talaga na-asthma to. After na nabakunahan, saka na siya nagkaroon ng asthma. Kaya kinorelate nila na baka dahil
They correlate,
sa bakuna.
but we do not know if it caused.
Oo.
Yeah.
And so to look at cause, we have to look at the millions of children around the world who were vaccinated, and we do not see that cause. So we, unfortunately for this child, it looks like there was just a correlation.
Dalawa po sila, Father, nag-uusap. Yun daw yung nangyari sa mga anak nila, nagka-asthma. It also could be the weather.
It also could be the weather. It could also be it's just the flu season. So there are many possible reasons aside from the vaccine why those children became asthmatic.
Yeah. Okay. Now, Father, we have to spell it out sa ating mga kababayan na gusto ng mga practical tips pagdating sa ating survival. Kasi nga, lumalabas, pagdating ng kapag lumabas na yung EO, nasa gut feel na natin kung am I safe in this area or not? Ano mga pwede nilang dapat i-observe kapag kailangan nilang mag-mask o kailangan nilang mas dumistansya.
Yeah. So we have to understand our health risk. If you are young, if you are vaccinated, if you are boosted, if you had COVID-19 before, then the risk is down.
Yes.
If you are senior citizen, if you have comorbidities, including asthma, for example, if you have not yet had COVID, if you are not boosted, then these are higher risk populations. So when you go out, you have to decide if you're in a high risk population and you are going to a place where there's
a mall.
You wear mask. But if you are young and you said, I'm not really that worried about, I already got COVID twice. If I get COVID, it'll be a third time. Then you don't have to wear masks. So each one of us has to make a decision. Now, it's not only ourselves. We have to think about our families. So if I have Lolo and Lola in my house, and Lolo and Lola are seniors with comorbidities, then even though I'm young, I should wear a mask because I do not want to get sick and then bring the COVID back home. Now, given that my Lolos and Lolas hopefully are all vaccinated and boosted, and hopefully when the bivalent arrives, we will be boosted again. And that's what will happen. So over the next few years, we should expect that our senior citizens and our vulnerable Filipinos will be vaccinated maybe once, maybe even twice a year to protect from COVID.
Common sense
That's
tsaka
what we
compassion talaga.
Yeah. But for the younger ones, no more na because they have enough immunity that even if they get sick, it will be relatively mild. So this is what it means to learn to live with COVID. It's just like we learn to live with the flu. It will take time for us to adjust. There will be some people who will still be scared, and that's okay. They will wear their mask. Maybe they even wear double mask, but they will slowly learn to come out.